all once again in the second session for this month in the subject of cons and endo. And today I shall be talking about endodontic diagnosis. Good evening, everyone. I am Dr. Nitin Kararia and I shall be discussing the important aspects of endodontic diagnosis some way in the high yield manner so that it helps you in solving your MCQs and help you in cracking the NEET MDS examinations. So let us begin with endodontic diagnosis. See, basically endodontic diagnosis high yield manner so that it helps you in solving your MCQs and so basically endodontic diagnosis means we have to diagnose the pulpal conditions. Endo means something inside the tooth and the pulpal status. So if we have to talk about testing of the status of the pulp, which is simply called pulp testing, it can be classified into three broad categories of diagnostic tests that we employ. The most common ones used in the clinical setting are the pulp sensibility test. Pulp sensibility tests. Okay. The second ones, they are the pulp vitality test. Pulp vitality tests. Okay. And the third ones, they are the special tests. Certain special tests that we employ for diagnosing the pulpal condition. As the name indicates, pulp sensibility test, they rely on viable sensory nerve fibers. They are the commonest type of tests employed for the judging the clinical status of the pulp, whether it is healthy or not. Sensibility test will rely upon viable sensory nerve fibers. Now, since they rely upon viable sensory nerve fibers and from the basics of the dental pulp histology, we know that principally two types of sensory nerve fibers are present in the dental pulp, A delta and C fibers. So these sensibility tests basically test the presence or absence of these viable sensory nerve fibers, which results in sensation of pain to the patient. So basically speaking, the pulp sensibility test, although they are the most common type of pulp diagnostic tests, they are an indirect measurement of the pulp vitality because vitality means measuring the blood circulation. These sensibility tests do not assess the blood circulation of the pulp, so they have a likely potential of giving a false diagnosis or they do not reflect the true histological nature of the pulp. But what we presume by an indirect testing method, if the pulp is responding with viable sensory nerve fibers, then the pulp has a capacity to be preserved or it is considered to be vital. On the other hand, pulp vitality test, they rely upon intact blood circulation. They rely upon intact blood circulation. So in the strictest sense, what type of test are the vitality test, which measure the blood circulation of the pulp? At times, both these conditions results in certain ambiguous results. The pulpal condition cannot be properly assessed. In such conditions, we have to rely upon special tests of the pulp. What are the special tests of the pulp? We would see subsequently in today's session. So first of all, let us start with pulp sensibility test. The first type of test are the pulp sensibility test. They rely upon intact nerve fibers. Pulp sensibility test are broadly of two types used in the clinical setting. They are the thermal test of the pulp. Okay, thermal means some sort of heat or cold is applied, and electric pulp testing, EPT. Two broad categories of pulp sensibility tests are present. Thermal tests. Okay. They can be divided into two types, principal two types. One is the cold test of the pulp, another is the heat test. So, cold test, heat test, and electric pulp testing. They together constitute the pulp sensibility test, one of the most frequently used tests in the clinical setting. If we talk about pulp sensibility test, means we would be applying either current, hot, or cold substances to the tooth, and we would wait for a response from the patient, whether the patient complains of pain due to application of these agents or not. So one of the potential and the biggest disadvantage of pulp sensibility test is that they are not purely objective, means they are not truly based upon the clinician's interpretation. We have to rely upon the patient's response. So the disadvantage of these pulp sensibility tests, we can say that they are more of subjective in nature. Subjective means we will have to depend upon the response from the patient, whether the patient shows any signs of pain or complains any pain due to application of heat, cold, or electric current. So basically, you have to understand that pulp sensibility test would test the viability of sensible nerve fibers in the pulp. Let us first see what cold testing is. Cold testing. As we know, what is the basic principle of cold testing? How do we assess the pulpal condition by cold testing? The principle simply says that application of cold stimulus to the tooth would cause dentinal tubular fluid movement. Isn't it? Whenever we apply a cold testing agent, there would be dentinal tubular fluid movement. This in turn would stimulate viable A delta nerve fibers. All of you know from the basics of histology that A delta nerve fibers are the sensory fibers present in the periphery of the dental pulp, just subjacent to the dentine. So whenever an agent is applied, there would be pain to the patient due to stimulation of A delta nerve fibers. And there is no direct stimulation of A delta nerve fibers, but stimulation happens due to dentinal tubular fluid movement. And this stimulation is perceived as pain. If you remember the basics of pulpal histology, these A delta nerve fibers, they carry the sensation of pain, temperature, and touch. So you are applying some agent and there would be pain to the patient. So this is the basic principle. Now, what is the protocol that is to be followed for pulp testing? An important point to remember with all the pulp sensibility tests is that we have to always test adjacent and contralateral teeth first. Adjacent and contralateral teeth first. Why? Because these are all subjective tests. We have to rely upon response from the patient. So, what type of response do we get from the patient? We have to ascertain by testing the adjacent and contralateral teeth first. So, remember that whenever you are applying a cold stimulus, it would never be applied directly onto the offending tooth or the tooth suspected of being the culprit. We would always apply the agent on the adjacent and the contralateral teeth of the same arch. This helps in establishing a baseline response. It helps in establishing a baseline response from the patient. So once the baseline response is established, we would know that at this particular level of application, the patient senses pain, and this is natural tendency for the patient. So when we apply it to the offending tooth, we can compare it from the adjacent and the contralateral healthy teeth. So this is the basic cardinal principle for testing the teeth via sensibility test. Sensibility means whether it is cold, heat, or APT, you have to always test the adjacent and the contralateral teeth to establish a baseline response. Now, what is the testing agents? What all agents can be used to apply cold to the tooth. See, testing agents, they can be numerous testing agents. The simplest one is cold water, or we can say ice water can be applied. Then we can use some specialized agents like DDM, that is difluoromethane. It is a cold agent with a temperature of negative 50 degrees Celsius, difluoromethane. Another cold testing agent, we can use solid carbon dioxide, which is also called dry ice. Okay. This is the coldest testing agent available with a temperature of negative 78 degrees Celsius. Average temperature is negative 78 degrees Celsius. Then we can use ethyl chloride. What are these? These are substances to apply cold to the tooth, which is cold enough to stimulate the A delta nerve fibers via dentinal tubular fluid movement. Ethyl chloride, which is also called skin refrigerant. Temperature of negative 41 degrees Celsius. We can use certain specialized agents for cold testing, that is green endo ice. Green endo ice is a commercially available testing agent like a deodorant can. It is available in a container that can be sprayed onto a cotton pallet and applied to the tooth structure. Green endo ice. This is chemically 1112 tetrafluoroethane. And this agent has a temperature of negative 26.2 degrees Celsius. So these are some of the predominant cold testing agents that can be used. And one of the most effective ones is definitely green endo ice, because unlike difluoromethane, it is not detrimental to the environment. It has a zero ozone depletion potential, and it is a customized agent for dental testing purposes. Now, what is the method of testing? How do we test the teeth with cold testing? If we talk about sequence in a particular arch, the direction of testing is from the posterior most tooth in a quadrant to anterior tooth. The direction of testing is from the posterior most to the anterior. From the posterior most to the anterior, we basically follow the direction of the course of nerves. Okay. We have already seen that adjacent and contralateral teeth are tested first. Adjacent and contralateral teeth are tested first. Why this is done? To establish a baseline response from the patient. Okay. And teeth are isolated under rubber dam. For proper isolation is must, because if we do not isolate the teeth under rubber dam, the response that we are getting can be erratic, because that testing agent may be getting a response from an adjacent tooth or from the gingiva. It can result in false interpretation. So it is important that the tooth being tested is properly isolated from other teeth and the soft tissues, so that whatever response we are expecting is generated from the offending tooth only. Okay, so these are the three important points you have to remember. The sequence is from posterior to anterior to follow the direction of the anatomic distribution of nerves. Adjacent and contralateral teeth definitely would be tested first, and we have to isolate teeth under rubber dam. Then we have to consider the agent application. Whatever cold testing agent we have chosen, we have to apply it onto the tooth being tested. For agent application, two factors need to be considered. What would be the time of application? How much time do we apply the agent? So time of application. And the second factor is site. Which area of the tooth We should apply the testing agent so that we get the best possible response from the patient. The time of application is usually in the range of 15 seconds. I am talking about cold testing agents. Cold agent, whatever agent, maximum should be applied for 15 seconds. And the site of application is mid facial area of the tooth. Mid facial area of the tooth means if this is the tooth being tested, this is the tooth being tested, the agent would be applied on the mid facial area so that maximum possible surface area is exposed to the cold testing agent and we get the best predictable response from the patient. Okay. Now, whenever we apply a cold testing agent like solid carbon dioxide or ethyl chloride or green endo ice, it is not directly applied to the tooth. It is applied with number 2 cotton pallet. Means if this is a cotton pallet, okay, a number 2 cotton pallet, it is saturated with the cold testing agent and this cotton pallet is then applied onto the mid-facial area of the tooth being tested. So this is how we do cold testing of the teeth. These are the general principles for that. What are the results that we can get from cold testing? If we talk about the inference of the cold testing, then it, as I've already told you, it is a sensibility test. It simply gives an indication that some viable nerve fibers are present and it does not reflect the true histological status of the pulp. So, exact diagnosis of the histological status of the pulp is not possible with cold testing, but cold testing is most accurate in circumstances of advanced irreversible pulpitis or we can also talk about pulp necrosis. The disease of the pulp is extended to an advanced stage of irreversible pulpitis or up to pulp necrosis. In such conditions, an accurate diagnosis can be made in the clinical scenario. What we would get the result? Pain relief due to cold application. A patient comes to you and says that whenever I drink very cold water or apply a cold agent like ice pack on the side of the face, I get relief from the pain. Then the diagnosis can be ascertained that it is a case of pulp necrosis or advanced irreversible pulpitis. See, usually what happens in a normal healthy tooth, when you bite upon some very cold agent like an ice cream, you feel momentary pain. That pain is due to stimulation of the delta fibers and the pulp is considered to be healthy because it is a momentary pain. On the contrary, what is happening when the patient is applying a cold agent, the patient's pain is relieved. The patient pain is gone. Why the patient's pain is gone? Because the patient was having advanced irreversible pulpitis or pulp necrosis. The pulpal pressure was markedly increased that was causing throbbing pain. Whenever something cold is applied, the pressure plummets, falls down, and the patient gets relief from the pain. So application of an extremely cold agent to the tooth results in relief of pain. The diagnosis can be advanced irreversible pulpitis or pulp necrosis. This is the only clinical condition that can be successfully diagnosed. This is the cold testing. Then we talk about another thermal test, that is heat testing. Okay. Heat testing. What is the basic principle of heat testing? See, all of you know that heat is more damaging as compared to cold. So whenever heat is applied to the tooth structure for prolonged duration, it causes stimulation of pulpal C fibers. C fibers are the majority, 80% of the sensory nerve fibers present in the dental pulp are C fibers. So whenever C fibers are stimulated due to application of heat, the patient feels pain. So again, this stimulation would result in sensation of what? Sensation of pain. This is the basic testing principle. What are the agents that we can apply for heat testing? Just like cold water, we can use hot water. We can use hot burnisher. A ball burnisher can be heated onto a flame and applied to the tooth. It is not actually touching the tooth, but is taken to it some distance from the tooth, a couple of millimeters, so that the heat is radiated onto the tooth structure. Remember, the hot burnisher should not be touched onto the tooth surface. Then we can use rubber disc rotated against the tooth, that is called mechanical energy. Mechanical heat is applied. Okay. Or we can use heated gatta parcha. Heated gatta parcha stick. This heated gatta parcha is one of the most reliable methods of heat application because this gatta parcha, it melts at 65 degrees Celsius, and this temperature is the temperature which is required for the successful stimulation of C fibers. So whenever I am using a gatta parcha stick and heating it over to the flame, the moment it starts to soften and melt, the temperature is sufficient to stimulate the C fibers of the pulp. We do not require any special instruments and materials for testing of the pulp via stimulation of C fibers. So heated gatta parcha, because it has a melting point of 65 degrees Celsius, and this is the temperature required for stimulation of C fibers, is one of the simplest and effective methods of heat application. What is the sequence or method of testing? The method of testing, basically the three cardinal points remain the same. That is, adjacent and contralateral teeth should be tested first. We have to isolate the teeth under rubber dam, and the direction of testing would be from posterior to the anterior in each quadrant. They remain the same. Agent application, if we talk about, then again we would talk about two aspects of agent application. One would be site of application, another would be duration of application. Site is again the mid-facial area of the tooth being tested, and duration we would keep it maximum 5 seconds because heat is more damaging. Our purpose is to test the pulpal status, not to damage the tooth by excessive heat application. So mid-facial area, if I am using a heated gatta parcha, then a heated gatta parcha, when applied to the mid-facial area, has a tendency to stick. A heated gatta parcha would become stuck to the mid-facial area of the tooth. To prevent the gatta parcha from sticking to the tooth, I would coat the surface with. We would coat the surface with Vaseline. So instead of directly applying the agent onto the tooth surface, a lightly thin film of Vaseline is applied so that the heated gatta parcha would not stick and would not result in excessive pain or damage of the pulp. This is how we test the tooth with heat testing. Heat testing is least accurate method. It is the least accurate method of pulpal testing, heat testing. So rarely any clinical condition is present which can be successfully and predictably diagnosed for by heat testing. So it is one of the least accurate methods of what? Pulp sensibility testing. The third method of pulp sensibility testing is electric pulp test. Now, because of the convenience, electric pulp tester has become one of the most common methods of pulp sensibility testing, EPT. Okay. What is the basic principle? Whenever we apply electric current via EPT onto the tooth surface, there is again stimulation of Which fibers? A delta fibers. And this stimulation of A delta fibers via electric pulp tester causes pain, and we assume the pulp to be viable because viable nerve fibers are present in the pulp. Okay. So agent is electric pulp tester only. What is the method of testing? The method of testing, I'm again repeating, the first three things are the same for all sensibility tests. That is, test the adjacent and contralateral teeth first to establish a baseline response. In each quadrant, we start from the posterior most tooth and come toward the midline. And thirdly, the teeth should be isolated under rubber dam for accurate results. Site of application. Where should the EPT electrode be applied? It should be applied in areas of highest neural density because our purpose is to test via application of current and stimulation of A delta nerve fibers. So in the areas of the tooth where the highest neural density would be present. So for anterior teeth, if I talk about highest number of A delta nerve fibers would be present below the incisal edge. Pulp horns are present below the incisal edge. For posterior teeth, the pulp horns are present below the cusp tips. So cusp tips are the preferred location for EPT application. Which cusp tip? Mesiobuccal is most favored because from the knowledge, again you know that mesiobuccal cusp has got the highest pulp horn. So whenever we are applying an EPT electrode, the most predictable response we get from the tip of mesiobuccal cusp. So generally we keep it on cusp tips. Specifically the question is asking which cusp tip? Mesiobuccal cusp tip for posterior teeth. Okay. So these are the methods through which we use sensibility testing. Now particularly for electric pulp testing, if we talk about results, what results or inference we can derive, then electric pulp testing has an incidence of false negative results. There can be clinical situations where we get false negative results, or we can get false positive results. What is the meaning of false negative results? The patient is not giving any response even to the highest level of current, but in actuality, the pulp is viable. The patient should be feeling pain, but the patient is not giving pain. So we assume the pulp to be falsely non-vital, false negative results. The opposite is false positive results. The pulp is degenerated, necrotic, but still on application of EPT, the patient complains of pain. That is false positive results. So what could be the clinical situations which give rise to these two conditions? If we see the major clinical conditions, the false negative results, no response is generated, although the pulp is viable, is from immature teeth. Immature teeth means the root is not completely formed. When the tooth matures, the A delta nerve fibers are the last principal sensory nerve fibers to mature with the tooth. So in an immature tooth, the A delta nerve fibers are not fully mature. So EPT does not produce any response. Immature teeth. Similarly, in recently traumatized teeth, we get false negative results. The patient would not give any response to even the highest level of currents. What are the clinical situations? A sedated patient, a patient who is under the influence of either some drugs like tricyclic antidepressants, benzodiazepines, etc., that have a calming effect on the nerves, then these patients with drugs or under the influence of alcohol. Okay, they would again give false negative results. Then heavily restored teeth. Heavily restored teeth with thick bases. Teeth have got large restorations with thick bases, again would give false negative results. Why? Because the bases are poor conductors of electricity. The current would not be conducted to the A delta nerve fibers and the patient would not give any response, although the pulp is viable. So, these are the important clinical situations which give rise to false negative results. False positive, we talk about definitely an apprehensive patient. A patient who is fearful about the test being done, the procedure is not accurately explained to the patient, would give rise to false pain even when the pulp is not viable. Okay. Similarly, improper isolation. If you have not isolated the tooth properly, the response may be generated from what? Adjacent teeth as a false positive response. Metallic restorations. Large metallic restorations can conduct the current to the soft tissues and the adjacent teeth. Again, the patient has false positive response. Then there can be partially necrotic pulp. Especially in cases of multi-rooted teeth like maxillary and mandibular molars, if some viable nerve fibers are present in some of the areas, they can give rise to false positive result, although the majority of the pulp is degenerated. So there is no need to, I would say, simply cram these clinical situations. You can look at the options provided and very clearly and easily distinguish whether it is a false positive or a false negative response being generated. So these are the three types of pulp sensibility test. If we talk about accuracy of these sensibility tests, then cold test is the most accurate, followed by electric pulp testing, and heat testing is the least accurate of the pulp sensibility test. Okay, these are the most common type of pulp sensibility tests. Now we talk about vitality tests. Vitality tests. They measure the blood circulation. The principal vitality tests are pulse oximetry and laser Doppler flowmetry. Pulse oximetry and laser Doppler flowmetry. Okay. Pulse oximetry uses two type of lasers, that is red and infrared laser. Okay, two type of lasers for the measurement of blood oxygen saturation, and it measures what? It measures blood oxygen saturation. All of you must have used pulse oximeters. It has become a household appliance since the pandemic set in. Everyone was measuring the blood oxygen saturation levels during the time of pandemic. So basically, it uses two type of lasers, the red laser with a wavelength of 640 nanometers and an infrared laser with a wavelength of 940 nanometers. When these two lasers are passed through the vascular bed, it gives an idea about the blood oxygen saturation. And the working principle of pulse oximetry is Beer-Lambert law. It is a physics law on which it is based. This is how it works. And what is the inference that we get? We get an idea about the blood oxygen saturation And definitely when the oxygen saturation is more hemoglobin is present and more vascular the tissue is. Similarly, if the blood oxygen saturation is reduced, means the hemoglobin to carry the oxygen is reduced and the tissue is becoming non-vital. So this is the basics of pulse oximetry. On the other hand, laser Doppler flowmetry, it also uses a laser that is helium neon laser with a wavelength of 632.8 nanometer, which is a near infrared laser. Another laser is used, that is helium neon laser. What is the principle of laser Doppler flowmetry? As the name indicates, it is based on Doppler's principle. All of you must have read about Doppler's principle in your school physics. The frequency of light is shifted when it is reflected from a moving object depending upon the velocity of the object. So if there is a moving object and we fire a light of particular frequency, the light that is reflected by the moving object would be of different frequency than the original. This is like the working principle of the traffic police interceptors. You must have seen the traffic police interceptors. They gauge the speed of the vehicle. If the vehicle is moving faster than a designated speed, then there is a greater frequency shift of the light fired from the interceptor, and this is known as Doppler's shift. Similar thing happens means if the tissue is vascular, having a lot of blood circulation, then definitely number of RBCs moving inside the blood vessels would be higher. And when these RBCs move at a high speed inside the blood, the frequency of laser is Doppler shifted. That is the working principle of laser Doppler flowmetry. So what actually it would measure? Unlike pulse oximeter, which was measuring blood oxygen saturation, laser Doppler flowmetry measures red cell flux. The parameter being measured is the red cell flux, and the principle on which it is based is Doppler's principle. So these are the two important and the principal type of pulp vitality tests. If we have to see the accuracy of these two tests, then pulse oximeter is less accurate than laser Doppler flowmetry. Laser Doppler flowmetry is the most accurate pulp vitality testing method. What are the advantages of these two pulp testing methods? Firstly, they are purely objective. That is what we need from a test. Any testing method should be purely objective, means the results and the interpretation should be entirely controlled by the clinician to avoid any errors from the patient. Secondly, these two tests are non-invasive methods. Pulp vitality testing methods are non-invasive. Non-invasive means we are not causing any form of heat, cold, or current application that can be damaging to the tooth structure. Third advantage, if we talk about, they give clinical idea of the histological status. If pulse oximeter and laser Doppler flowmeter shows that the pulp is vital, then histologically also the pulp is most likely to be vital. So it is an interpretation of the histological status as well as the clinical status of the pulp also. If I talk about disadvantage of these methods, the most important disadvantage is that there is no customized dental equipment available. In the market, you do not find a pulp testing method which is based upon vitality testing and a device is available. So no readily commercially available device is available which is based upon these two diagnostic methods. Secondly, they can be used only on natural teeth. Although These two methods are very accurate in diagnosing the status of pulpal blood circulation. They can only be used on natural teeth. Suppose you have to test the pulpal status in a tooth with full coverage crowns, then you cannot use pulse oximetry or laser Doppler flowmetry. In a situation where there are full coverage crowns, which method is best? Cold testing with solid carbon dioxide is best because we have seen that dry ice has a very low temperature of negative 78 degrees, which is able to penetrate through the full coverage crowns and stimulate the pulpal A delta nerve fibers. So these two methods, they can be used only on natural teeth. And improper isolation. If again we are not isolating the teeth, can result in false results, just like your pulp sensibility testing. Why false results? Because whatever lasers we are using, these lasers can penetrate the adjacent healthy teeth or the soft tissues and give rise to false readings. So isolation is very much important whether we are doing the pulp vitality testing or the pulp sensibility testing. Okay, some accessory tests. Accessory vitality tests. The principal ones are pulse oximeter and the laser Doppler flowmetry. The accessory vitality tests, they are, you have to remember the names: xenon 133 radioisotope. Okay. Then we have tooth surface temperature measurement. Tooth surface temperature measurement. Okay. Tooth surface temperature measurement broadly encompasses two methods. What is the basic philosophy? If the tissue is vital, if the tooth pulp is vital, the tooth surface would be warmer, and if it is non-vital, the tooth surface would be colder. So that is the basic principle. We can use a Hue probe camera. It is a special camera based upon lasers that measures the temperature differential of 0.1 degrees Celsius. Okay. So this can be used to ascertain the tooth surface temperature. And we can use 10% cholesterol liquid crystals. A 10% solution of cholesterol liquid crystals is applied onto the tooth surfaces, and depending upon whether the tooth structure is vital, means having blood perfusion, and non-vital, that is not having blood perfusion, it can give rise to fluorescence of different colors. Okay. So basically, the details are not required for your MCQ solving. What you have to remember in vitality testing, the two principal methods and the names of these accessory methods. Then there are certain clinical situations which demand special testing of the pulp. So what are the special pulp tests? Special pulp tests. Broadly speaking, there are four types of special pulp test depending upon the clinical situation. One is the bite test. The second is trans-illumination. Trans-illumination. The third special test is anesthetic test. And the fourth special test is test cavity. Test cavity. These are the four special tests of the pulp. If we see them one by one, what is the bite test? The bite test is basically used to find the situation of cracked teeth. What are cracks? Cracks and crease lines, they are incomplete fractures. So cracks, they are incomplete fractures of the tooth where there is no loss of tooth structure, and they can give rise to confusing clinical situations, symptoms to the patient. So whenever we suspect a crack in a tooth, we can use a bite test. Bite test uses device, two devices which are similar in morphology are used, similar in design, that is tooth sleuth or frac finder. Tooth sleuth and frac finder. What are these? These are two commercially available devices. These devices have a shape like this. There is a handle. If we see the device from above, there is a platform, and in the center of this platform, there is a depressed area. If we see this device from the side, it appears something like this. This is the handle, and this is the shape of the device, whether tooth sleuth or frac finder. Now, what is done? One cusp of a tooth is accommodated at a time into this depression present in the center of the platform, and this is the opposite tooth, and the patient is asked to bite down one cusp at a time. Okay, we apply it, place it into the concavity, and ask the patient to bite down and release. So what we suspect, patient feels pain on release of pressure. When the patient bites down, there is no pain, because mostly whenever the patient bites down and there is pain, means there is tenderness on pressure. We suspect apical periodontitis. Here, there is no pain on patient when the patient is biting down, but there is pain on release of pressure. What happens if there is a small undiagnosed crack in the tooth? Whenever the patient releases the pressure, there is microscopic movement of the crack segments that causes dentinal tubular fluid movement and causes stimulation of A delta nerve fibers. So release of pressure, there is tubular fluid movement. In the region of segment fractured, this causes stimulation of, again, what? A delta nerve fibers, which are the sensory nerve fibers, and it causes pain to the patient. So whenever the patient is having pain on release of pressure, we can suspect that this particular tooth has got a a crack, which is an incomplete fracture. This is used to diagnose the cracks in the tooth. Another thing, we have now diagnosed that there is a suspicion that this particular tooth may be having a crack, but you are not able to see the crack clinically. The second special testing that can be used to see the crack is staining and trans-illumination. Staining and trans-illumination. Okay. We would, as the name indicates, stain the tooth with a chemical and then see the tooth by illuminating it through the tooth structure. Staining mostly is done with 1% methylene blue. We would apply 1% methylene blue to the suspected tooth, wash it off, and then trans-illuminate the tooth. Trans-illumination, suppose this is a tooth suspected of having a crack. From one side, a high intensity white light is shown. Okay. If there is a crack in the tooth, there would be fluid in the crack. There would be fluid in the crack. That fluid in the crack, it would block transmission of light. Okay, so this part, it would appear light, excuse me, and this part would appear dark. The proximal part would appear light, and the distal part after the crack would appear dark. And this is done entirely in our darkened room. We switch off the operatory lights so that the only light in the operatory is the light which is used to illuminate the tooth structure. So what is the basic principle? Whenever there is a fine crack in the tooth, there would be fluid present in the crack. That fluid would block the transmission of light to the other segment, and the proximal segment, or the segment that is close to the light source, would appear bright, and after the crack it would appear dark. So because of this distinction, we can clearly identify a crack present in the tooth. Okay. So both staining and transillumination and bite tests are used for diagnosing teeth with incomplete fractures called cracks and craze lines. What is the difference between a craze and a crack? Craze is present only in the enamel, and crack extends to the dentine. Both are forms of incomplete tooth fractures. They can be diagnosed with these two special tests. The third special test is anesthetic test. Anesthetic test. Okay. Anesthetic test is relevant in a situation when arch of offending tooth means the patient simply says that he is having pain on either the right or the left side and not able to identify whether it is because of the upper or the lower tooth. Then we have to identify the arch, means whether the pain is coming from a maxillary or a mandibular tooth, or it is a non-odontogenic pain. Then we can use anesthetic test. So what is the basic purpose of doing anesthetic testing? To identify the arch of offending tooth. Offending tooth means a tooth which is causing pain to the patient. Anesthetic test is used. What is done? We give inferior alveolar nerve block to the patient, IANB, whether the pain is on the right, on the left side. Correspondingly, we will give anesthetic test on that side of the face. IANB stands for inferior alveolar nerve block, is given to the patient on the suspected side. If the pain is relieved, then definitely the offending tooth is a mandibular tooth, because the inferior alveolar nerve block would anesthetize all the teeth in that particular quadrant, mandibular teeth. If the pain is not relieved, then there can be two potential causes. It can be a maxillary tooth, or it can be due to other causes. Okay, it can be a maxillary tooth if the pain is not relieved. We cannot be sure about it. Or it can be due to other causes like a non-odontogenic cause of pain, isn't it? Now we give maxillary infiltration blocks. Maxillary infiltration blocks. If the pain is relieved, then the suspected tooth is a maxillary tooth. If the pain is not relieved, we have to go for further non-odontogenic causes. It can be a non-odontogenic pain. So whenever the arch of the offending tooth cannot be identified, the patient is having confusing symptoms, we would employ anesthetic testing. Now remember that anesthetic testing is not used to identify an individual tooth in an arch. In some of the textbooks, you will find out that after finding that whether it is a maxillary or a mandibular tooth, we would give intraligamentary injections into one tooth at a time to identify the offending tooth in that arch. But that is not a very accurate method of testing because giving intraligamentary injection into one particular tooth can also anesthetize the adjacent tooth. So what is the principal indication for anesthetic test is to identify the arch of the tooth which is causing the pain, whether it is the maxillary or the mandibular arch. Okay, and not to identify a particular tooth into that arch. Then the last resort of testing, when all the methods have given ambiguous results and we cannot ascertain the status of the pulp, the last resort is called preparation of test cavity. So it is a special test of the pulp that is used as a last resort always. Why last resort? Because it is an invasive method of testing. As the name indicates, test cavity, we would prepare a cavity into the tooth suspected of having some problem. And since damaging the tooth structure is there, it is an irreversible method of testing the tooth. That's why it is used as the last resort of pulp testing. As the name indicates, test cavity, a small round burr is used. A small round burr can be number 2 or number 4 round burr with a diameter of 0.5 to 1 millimeter can be used to prepare class 1 cavity in the suspected tooth. Class 1 cavity in the suspected tooth. An important thing is no local anesthesia is given to the patient. LA stands for local anesthesia. On a non-anesthetized tooth, we would start preparing a class 1 cavity. So if this is a tooth suspected of having a pathology, we would prepare a class 1 cavity. And as we increase the depth, the moment the burr reaches DEJ of a non-anesthetized tooth, which is also having viable pulpal nerve fibers, the patient would feel pain. Okay. And this pain indicates that the pulp is viable. I am saying viable. I am not saying pulp is vital because we are not able to gauge the blood circulation of the pulp. Presence of pain simply indicates there are viable sensory nerve fibers present in the pulp, and we have to do further testing or wait and watch to ascertain the pulpal status. If again, while doing this, we have penetrated the DEJ and there is no pain to the patient, the pulp is considered to be non-viable or degenerated. So this is called test cavity. If the patient is feeling pain, we would seal the tooth. If the patient is not feeling the pain, we would proceed further as the need may be for doing pulpectomy or root canal therapy. So these are the basic sequence in which we test the status of tooth to ascertain the pulpal condition from the beginning of pulp sensibility test to the pulp vitality test. The pulp vitality test, although can give very good results, are not commonly available. No special devices are commonly available in the dental clinics. So they are definitely better, but are not common, and the special testing depending upon the pulpal status. So this is, in short, for today's session, the high facts that I've told you about the testing of the pulpal condition. With this, I conclude my today's session, and I wish you all a very happy, healthy, and prosperous Diwali. Best wishes to everyone. Enjoy the festive time and good luck. With this, I am signing off. Good night. Thank you very much for